Staying with us is still GTV Breakfast, and at the GTV Breakfast clinic this morning, we are going to be engaging you and your family on a very important lifestyle changing chronic ailment. Tomorrow, 10th May, is World Lupus Day, and we welcome especially Dr. Richard Doe, who is a specialist physician with the rheumatology unit at the Korle Bu Teaching Hospital, who will be speaking to us about the chronic autoimmune disease that affects millions of people worldwide. Dr. Doe has been extensively involved in the research, diagnosis and treatment of lupus, and has helped many patients to manage their symptoms and improve their quality of life. In this interview, we will be discussing the latest advancement in lupus research and treatment, as well as providing valuable information for anyone who has been diagnosed with the condition or knows someone who has. We also have with us Miss Dorcas Mayer to share her experience and her journey to surviving lupus this morning. Stay with us. Without much talking, let's welcome Madam Dorcas Mayer. Good morning.
Good morning.
Dr. Doe, good morning.
Good morning.
How are you?
I'm fine.
Tomorrow is the day, but let's zoom quickly into lupus and what it is, what causes lupus. What is it? What causes it?
So lupus is a short name for a very long name, which is systemic lupus erythematosus.
Wow.
It's a mouthful word, and so we try to use lupus to represent it so that everyone can say it and then also remember it. So lupus is a chronic systemic disease, and it comes under diseases that we call autoimmune diseases.
That's what you have to break down for us, doctor.
We'll try and break it down.
Cool.
So when we say autoimmune, we all have an immune system in our body that helps us fight diseases and any other things that the body thinks it does not need. But in people who have lupus or systemic lupus erythematosus, their own immune system seems to have problems and it attacks their own body cells. And so it is like your own internal soldiers or policemen deciding to fight against yourself. And we say it's systemic because it can affect all parts of your body from head to toe. Right. And it tends to be chronic.
How very common or how common is lupus?
Lupus is common, and indeed that is why the World Lupus Day has been set aside, and the whole month of May has been declared as the Lupus Awareness Month.
Right.
Lupus affects about 2.4 people of 1,000. So if you take about 1,000, you have about 2.4 the prevalence.
Wow.
And it keeps increasing. In Korle Bu, we see an average of about 6 cases per month, new cases. And these are the ones that will come to hospital. Those that are not in hospital are also out there. And that is what we hope, that this awareness will really get to. And those who have not yet gotten to us would also get to us and get some help.
Right. So when someone comes to Korle Bu, what tests do you carry out first to establish whether or not they have lupus?
So normally we would look at your signs and symptoms. And that is what really gives a lot of people a lot of problems. Because the signs and symptoms, I must tell you, look like any other disease that you might have come across. The very common ones like malaria, typhoid. So most people will have joint aches, would have body pains, may even have a fever.
Right.
But most of the time, they tend to have skin lesions. And when they have these skin lesions, that sometimes brings them to hospital because that is obvious for everyone to see.
Right. So we're
have some
putting
audiovisuals.
One of the very first image with the lady whose eyes seem to be closing. Yes.
So this lady has what we call the malar rash.
Okay.
And if you look closely to the part of the eye, down there you will see some rash. And it looks like it is in both eyes. So we call it the butterfly rash. Now the butterfly rash is classical but not everyone with lupus will get this butterfly rash.
Okay, so they vary in their appearance.
They vary in their
Okay,
appearance
so
and in their presentation.
let's have a there's a few of the images you sent to us. Let's take the second. My production team will help me with that. Yes.
Great.
And so we have
so
what
you
looks
could
like
have hair loss, and this hair loss, in Ghana, if you get this, they are going to say you've got ringworm.
okay.
And you are really going to treat it in all the other places that you can, including using non-orthodox means.
Okay.
But you need to get to us. Don't blame your hairdresser or, if you like, your barber. You should come to us rather. So they could have hair loss,
right,
and that is another hair loss. We call it patchy hair loss. Yes, there could be swellings of all your joints, including your small fingers, the knees, as is being shown there.
Doctor, with swollen joints, doesn't it present signs such as which mimics arthritis?
Good. So, in fact, the arthritis, there's a type that also comes under the autoimmune diseases.
Okay.
And if you have your joints swollen, just don't go for a massage. Get to the hospital, and if you have heard about lupus, do ask your healthcare provider. Please, I've learned about lupus. Could it be lupus? It could be any other thing. You could have just fallen and then gotten a swollen knee. But we always want to be sure it is not lupus.
And there are some, I saw one, yes, this very one with what looks like itches or rashes on the body with swells on
So
it.
they get what we call photosensitive rashes.
Okay.
So in the sun exposed, the places that are exposed to the sun, you may get rashes.
Right.
And sometimes some of them may form these nodular or small swellings like pimples.
Right.
And they may be there. So when you are getting rashes, don't always say that it is whatever name you want to say it. But get to the hospital and let them find out.
Right.
Don't think it's chicken pox.
Right. Doctor, before I bring Dorcas in, let me quickly come to you. How common is this among adults or children?
Good. So lupus can affect all ages.
Right.
And I must tell you, we diagnose a child at the age as early as 2 years.
Right.
And so children to adults. And in adults, we say that it's more common in the reproductive age and common in females.
Okay.
Males can get it,
Right.
but it's not that common. And when males get it, it tends to be more severe.
Right. Right. Okay. Let me bring on Dorcas. Dorcas, welcome once again. How old were you when you were diagnosed with lupus, and what type or where was your symptoms?
Okay, so I was 19 years.
Okay.
And now I'm 33 years. So that's about 14 years ago.
Yeah.
I was diagnosed with lupus. My symptoms, I had the butterfly rash.
Okay.
I had hair loss.
I saw your reaction windows were on the screen.
I could just put my hand in my hair, the hair would just come out like that.
Wow.
So I had hair loss, I had joint pain, and then the swollen arms. It was all swollen every time. My legs and my arms were swollen.
How surprised or how devastating were you when you heard you've been diagnosed with lupus?
It was very devastating. First, I read when I was diagnosed in 2009, I didn't have much idea about it.
Okay.
But later I read about it and I'm like, wow. And you know, they said you are going to manage it all your life. So I'm wondering, hey, how am I going to go through this thing all my life? So initially I knew I had lupus. It wasn't easy for me at all. It was very, very devastating. I was like, where is this thing coming from? What did I do to get this disease? Yeah.
Awesome. Right. Let's look at cost implication financially. How were you affected with managing or treating this ailment?
Yeah, treating lupus is very, very, very expensive. I remember some time ago, some of the drugs I was buying a month, some up to 3,000, 2,000, and then the labs you have to do, the routine labs alone, is quite expensive. There are times I did biopsy, I did the blood infusion, all those things. It comes with a lot of costs.
Let me come to Dr. Doe. Obviously, from what she's just told me, I can imagine what the burden will be on the family as well. When people are diagnosed with lupus, how do they respond to your diagnosis, and how does that affect their family as well, especially with children?
Great. So anyone diagnosed with lupus, whether a child or those in the reproductive age. It is always a very sad news for them, because one, they do not know a lot about lupus, and they think that is the end of life. But as Dorcas has shared her story, she's been living with lupus for 14 years now. There is hope. If you are diagnosed with lupus, it's not the end. We have health personnel who would take good care of you. There are medications. The problem is that these medications are expensive, and so they tend to go beyond the packet of the ordinary Ghanaian. Wow. And we are hoping that these medications would be put under the National Health Insurance.
Okay.
They will also have to do a lot of lab investigations, because these people will need to be on medications to help manage most of their symptoms and condition. And we need to do these labs to be sure that we are on good track. So even when they are not sick, they have to do what we call routine monitoring labs.
Right.
And that costs a lot of money.
Let's look at patients who present multiple symptoms. In the case of Dorcas, she had hair loss, she had, the butterfly rash. When one is managing or treating these, is it the symptoms you're managing, or perhaps the medication is to get rid of the condition itself?
Good. So that's the other part, that when you diagnose anyone with lupus, they always get frightened, because they will want to know if you cure them once and for all. At the moment, there is no medication that cures lupus totally. We manage it like how we manage hypertension and diabetes.
Okay.
So we say that it's a chronic disease, and you need to use your medications to suppress the disease, so that the disease will not take over your body, and then you can really be in control.
Thank you very much, Dorcas. Let me bring you on. Since it's a manageable thing, you only have to manage it because there's no. Talk us through your way of managing yourself, and how that perhaps decides or determines your interactions with other people.
Okay, so I want to describe my journey, then I tell you about.
Yeah.
Okay, so in 2009, our first year in the university, there were times I didn't have much idea about it, so I was stressing myself. Stress is one thing that when you don't manage very well, you always have to go back to the hospital. So you have to really manage your stress, yeah. And then there were times I'm writing exams, my hands were swollen and all that. Yeah. It wasn't easy at all. In the university like this, I had to take off my hair. So my 4 years in Legon, I was just with cap, because it was that bad. And I was always getting sick. So I was fortunate that it was diagnosed early because of the butterfly rash and the hair loss. It was so obvious that this was lupus. So I was diagnosed early. That's what helped. But through the journey, it has not been easy at all. I remember in 2018, I had a flare. I overstressed myself, and then I had a flare. So I was admitted at Kolebu for almost a month. Yeah, I stopped my medication. So the advice I'll give people is the medication is very, very important. Very, very, very important. When you take your medications, you check what works for you. Maybe in terms of diet, there are some food when I take, I become very weak. And then your lifestyle, you have to really manage your lifestyle, and then your stress levels. Right. If you're able to deal with all these things, you really live for long. God, by the grace of God, I've been married with 3 kids. Right. And I was diagnosed before I got married. Wow. So it has been a fruitful journey.
Thank you very much. Doctor, I'm coming to you. How likely, given that she was diagnosed even before she started bearing children, how likely is a parent to pass on the condition to their child? Is it hereditary?
Well, there's a genetic factor, but we don't say that it's directly passed on.
Okay.
So the causes of lupus is quite multifactorial. So we have a genetic component, we have an environmental component. And so if you have the genetic susceptibility, that is, you are predisposed, you could. But yes, it runs in families. And so if you have it, then we need to be keeping an eye on other family members. And if you are a mother, then we keep an eye on the children. However, there's always good hope, because if your symptoms are well controlled, you are not likely to pass it on to your newborn baby, what we call neonatal lupus.
Right, okay. Tomorrow is the World Lupus Day. Do you have any awareness programs planned for tomorrow, and where will that take place?
Good. So we declared the whole month of May as Lupus Awareness Day, and the World Lupus Day is on the theme Making Lupus Visible. And we do that by wearing purple. And so that is why we are in purple, and you see inscriptions in purple, and all those who are our volunteers are also in purple in the studio. So if you see anyone in purple, that means that we are making lupus visible. We are trying to tell people about lupus, and if you have lupus, there's help for you. You need to come to Kolebu. We have the support group called the Rheumatology Initiative, TRIAM for short. And on tomorrow, we are going to be on all social media. We also have programs on all the national media, as we are doing today, to educate people about lupus, to bring hope to people, and to let people know that indeed lupus is not the end of life. If you have lupus, you can go ahead and have your life just as Dorcas. You can marry, you can have your children. All you need to do is to have your interaction with your healthcare provider very well. We also would be doing educational programs on Zoom, which we intend to educate both our patients and our healthcare providers.
You may have to share the link with us, the Zoom conference link. You may have to share that with us so that at least we share with viewers who would want to even learn more about lupus.
Great, that would be done. That will be done. So we intend to do that, and also how to live with lupus will all be on the various Zoom media, and we'll share the link with everyone.
Thank you so very much. It's been great having you, Dorcas. We're wrapping up. We're all too soon out of time. But before we go, how do people react when they know you've got lupus?
Okay. Initially, I was not really open about, because I remember when I was doing my service, there were times people will always think you are lazy, but you are very weak, and the disease is not so visible sometimes, because with the hair you can cover up and all that. So people always think you were lazy. So there were only few people I opened up in the past. But now I don't mind at all.
You don't.
I'm open. I let people know that I have lupus, and I educate people. I work in a school anyway. And there was this day I was able to diagnose one. Okay, I didn't diagnose, but I saw the symptoms, and I made the lady come to Kolebu, and now she has been diagnosed. So so far people don't treat me I just let them
different from the rest of the population.
Any different.
Awesome. Thank you
I want
so very much.
Use this opportunity to really thank my family. They've been very, very supportive, especially my husband.
Thank you.
I thank him so much.
Thank you so very much. And that's where we draw the curtain on the lupus discussion. It is treatable. It's a condition. It has both genetic and environmental way of affecting people. And so don't hide yours if you're diagnosed or if you see any symptoms very unusual. Approach Kolebu, go to the rheumatology unit and get help. You can live a normal life with lupus. Thank you very much for staying with us.